Good morning. My name is Geoff Mearns, and I have the good fortune to serve as the president here at Ball State. And it's my pleasure to welcome you here this morning for a very special program. I want to extend a special welcome to healthcare professionals and health policy advocates and educators and community and business leaders and to elected officials. Thank you all for joining us this morning, and I want to express my appreciation to the Alliance for a Healthier Indiana for bringing this program to our campus and to our community. I think we all know we're here because we know that there are few outcomes that can make a bigger impact on the future of our state, on the future of our country. There are fewer items that can have a bigger impact than improving the health of our families and our neighbors. And that's why we're here today to discuss the ways that we can work together to improve the health of the people here in Indiana. Unfortunately, some of the statistics in Indiana and some of the statistics in Delaware County are not good. Delaware County ranks 85th out of Indiana's 92 counties in overall health outcomes. Of the adults living in our county, in Delaware County, 31% of them are obese. Smoking costs the state's economy $7.6 billion every year in increased health care costs, lost productivity, and premature death. And we all know the consequences of the opioid crisis. We hear about it every day in the daily news. It's draining us of a talented workforce, and it's costing us about $770 million every year in higher health care costs just in our state. These are sobering statistics. It's why we're here. And these statistics, these outcomes, demand that we do more to improve our state's health. And we at Ball State, our faculty, our staff, our students, all of us are prepared to act as partners with you in this important effort, and we lend our full support to the Alliance and to its advocacy work. I want to talk to you a little bit, though, spend just a few minutes this morning, talk about what we're doing on our campus to support these initiatives. If you drove down Riverside recently, you see one of the most visible signs of our commitment to health is going up just a few blocks from here. Our new Health Professions Building will open in the summer of 2019. It will be the new home of our College of Health. This was a college that we formed a few years ago in 2016 in response to the growing importance of healthcare and health professions and life sciences here in Indiana and across the country. It's a 167,000 square foot facility. It's multiple simulation suites, exam rooms, and an athletics training lab. It will also have clinics that will serve the community, clinics for psychological assessments, speech and audiology, nutrition, social work, and wellness. These clinics will serve not just our campus population, but the community as well. And I know we have several members here of the General Assembly with us this morning, and I want to thank you for your support for this facility. Without your support, that facility would not be possible. It will then help us to meet the need for more professionals in healthcare, and it will allow us to do it in an innovative way because we've brought together the different disciplines in the healthcare field, and it will help us to teach those students to work in collaborative professional teams. And we anticipate that this training will then produce better prepared professionals that will produce better outcomes for their patients. The construction of this new building is just the most visible and tangible demonstration of our commitment to a healthier Indiana, but it's not the only one. And as you know, a major topic of this roadshow is addressing the high rate of people in Indiana who continue to smoke. And we're going to hear more about how raising the state's cigarette tax could encourage smokers to quit, but also increasing revenue to support public health programs. Our university has been working on this anti-smoking initiative for many years. In 2012, our Global Health Institute partnered with the Centers for Disease Control and Prevention to produce a report that documented the prevalence of cigarette smoking here in Indiana and in Delaware County, and the effects of being addicted to nicotine. That same year, Indiana adopted a state smoke-free air law, which protected more of our citizens from the dangers of secondhand smoke. So the next year, in 2013, the university became a tobacco-free campus, which means that all forms of tobacco, not just cigarettes, all forms of tobacco use are banned anywhere on our campus grounds. And this policy is an important demonstration of our university's interest in bettering the health of our students, our faculty and staff, and those of you who come to visit us on our campus. With the adoption of this policy, our university began to provide services and incentives for our faculty and staff and to help our employees and our students to live tobacco-free. Today, our Employee Quick Clinic and our Student Health Care Center offer a range of counseling and prescription medications that help smokers fight those cravings. Our Employee Wellness Program, Working Well, offers initiatives to help faculty and staff get and stay healthy, mentally, physically, and emotionally. And our Health, Alcohol, and Drug Education Office offers free smoking cessation classes for our students. But perhaps the biggest incentive we offer our employees to maintain or begin to maintain a healthy lifestyle is our tobacco-free healthcare insurance premium. We provide a $900 annual tobacco-free premium discount, which is credited to employees who certify that they and their covered dependents have been tobacco-free for at least 6 months. And 92% of our employees take advantage of this opportunity. Thank you. And I'm grateful to our faculty and staff who administer that program, but I think we all know that we need to do more on our campus and more across the state. And that's why we're here to encourage and advocate that our lawmakers pass legislation to increase public health spending in 2019. But we recognize that we can't rely solely on our government. We can't rely solely on the government to combat our healthcare crisis. Today, we must accept that progress comes at the local level, here in our cities, here in our towns, here in our county. And I want to give you just one example of how this progress is playing out here in East Central Indiana. Last year, I've been on this job for about 13 months, I had the opportunity to meet Judd Fisher of the Ball Brothers Foundation, and he approached us about becoming partners in a new innovative physician training program right here in our community. And we were pleased and grateful for the opportunity to participate in this new initiative that's called Optimist Primary, because we all want more physicians who are here, who have been trained in this region, to stay in this region, to treat the people here in Muncie and in Delaware County so that they can choose to practice here and live here. So grant money from the Ball Brothers Foundation for Optimist Primary supports our collective efforts to enhance and innovate academic programming and housing options for medical students who are studying here in Muncie and Delaware County. And I want to express my appreciation to Judd and all the members of the Foundation Board for their leadership in funding this critical endeavor. So as we know from those statistics, we face unprecedented challenges to address and improve the health of our neighbors. Challenges that you know that we're facing and that you're prepared to discuss today. But I believe that working together with the people in this room and the people that we serve, that working together we have all of the essential ingredients to address these challenges and to improve the health of our friends and neighbors. And on behalf of the entire community here at Ball State, we are, as I said earlier this morning, prepared to partner with you and prepared to work with you. Thank you very much. It was a pleasure to be with you this morning. Enjoy your day.